Kuzuzampola, everyone. I'm pleased to be with you. My name is Marie Brien. I'm a physiotherapist from Ottawa, Canada, and I'm going to be presenting to you on the Enabling Inclusion Model and App, family-centered, community-based rehab in rural South India. And I'm also presenting on behalf of the team at Amar, Seva, Sangam as I collaborate with the Enabling Inclusion Program in South Tamil Nadu, India. So I thank you again for welcoming me to Bhutan. And now I will take you to South Tamil Nadu. And we have our welcoming Rangoli at the doorstep of the homes that we visit. Globally, at least 10% of all children have disabilities, and 80% of those children under the age of 5 live in developing countries. In India, there are 7.8 million children with disabilities, and we know that a high percentage of those have never attended any preschool program by the age of 5. So there's many challenges in low and middle income countries and barriers to inclusion that include high disability stigma, lack of rehab providers, and cost of services. So whether in Bhutan or in South India, different types of settings, rural, mountainous, remote, may pose different challenges to access to services for children and families. The Nurturing Care Framework was launched in 2018 to identify sets of best practices based on programs that have proven effective at improving early childhood development in high, middle, and low-income countries. So there are good health, nutrition, responsive caregiving, safety and security, and opportunities for early learning. They also develop strategic actions that are to lead and invest, to focus on families and their communities, to strengthen services, monitor progress, and to use data and innovate. So this picture is worth 1,000 words, and it represents well how families of children with disabilities often feel. So the objective of Amar Seva Sangam in developing the Enabling Inclusion model was to develop an innovative evidence-based service delivery model to provide early intervention and rehab services in lower to middle income countries with the following guiding principles. We wanted it to follow the WHO's International Classification of Functioning, Disability, and Health, to provide a framework for clinical practice to optimize health, function, participation, and environmental and personal factors. We also wanted to have a family-centered approach that recognized that the family and child's well-being are interrelated. And thirdly, we wanted to use the CBR strategy to enhance the quality of life of children with disabilities by meeting their basic needs and also facilitating participation and social inclusion. So we partnered up with various Canadian-based universities, University of Toronto, McGill, Handicare as an organization, as well as with Harvard Center for the Developing Child. We ended up having many funding partners since the 2013, 2014, when the model started in its existence. So through the years, many funders. And we started looking at what the elements of community-based rehab really is. It's empowerment, social justice at the center, inclusion, self-advocacy, equity, and self-sufficiency. We looked at the elements of the International Classification of Functioning, Disability, and Health, the WHO's ICF, that we needed to have a structure to look at both the body structure and function, the activities of the child and everyday functioning, participation within community, school, home, looking at the environmental factors that greatly affect every human being's function, as well as their personal factors. We needed to look at the elements of family-centered care, that the family is the constant in the child's life, that they require the family-to-family and peer support, that the importance of honoring their cultural diversity, the family traditions, the family strengths, families to determine the goals that they have for their own child, and also to have family-friendly, family-centered policies and practices, and celebrating success and strengths of the family and child. So we came up with the enabling inclusion solution. So the model that was developed as the enabling inclusion model was the integration of the ICF, family-centered care, and the community-based rehab strategy. So the aim is to maximize each child's potential for functional independence, participation, and inclusion through early intervention, family empowerment, capacity building, and community awareness. In 2014, Amar Seva Sangam, an NGO in rural South Tamil Nadu, developed an innovative service delivery model to provide access to community-based early intervention services for children with disabilities. The model was named Enabling Inclusion and is now supported by a digital health solution, the Enabling Inclusion application. So the objective is to facilitate connectivity between families, community rehab workers, and rehab specialists to provide evidence-based services in low-resource contexts. The main funder presently is the Government of Tamil Nadu's Disability Department, which funds Amar Seva Sangam to operate the program in 2 full districts of Tamil Nadu, covering 2,100 actively enrolled children. We also have the Azim Premji Foundation, which covers 1,000 actively enrolled children in 1 full district of Tamil Nadu. So these programs provide home-based child rehab and early intervention services. We also have partnerships with 6 other NGOs where the EI model is being replicated in 3 other districts of Tamil Nadu and 3 other states, Assam, Uttar Pradesh, and West Bengal. So there's various modules within the Enabling Inclusion model and app. There are validated screening tools. We also have an ICF-based child and family assessment. There are standardized evaluations across developmental domains and ICF components. There is family-centered goal setting tool and parent-reported outcomes and caregiver measures. There are needs and ICF-based intervention plans and activities. There are family empowerment groups, peer support, capacity building, social media outreach, livelihood, and assistive technology. There are community disability awareness and inclusion groups, community, women, and students. And lastly, there's training for child developmental workers, health workers, teachers, and parents. The secure cloud-based EI app supports the full cycle of the EI model, from screening to assessment and planning by the rehab specialists, to therapy in the child's home by community rehab workers connecting with rehab specialists, to re-evaluation and monitoring and reset of treatment goals and plans. The GPS-enabled cloud technology connects community rehab workers to rehab specialists so that high-quality rehab services can be provided to children and their families. The EI app holds the screening module, the specialist assessments and child outcome evaluations, the goals that have been set in the intervention plan for each child, the daily schedule, the tracking of family outcomes. There's also a management dashboard within the app. And then there are the awareness programs and capacity building modules. The validated screening tools within the app are the Trivandrum Development Screening Chart, the TDSC, as well as the UNICEF Washington Group Child Functioning modules. The ICF-based child and family assessment includes family-friendly questions addressing each ICF domain of body structures and function, activities, participation, the environment, and personal factors. The standardized evaluations across developmental domains and ICF components include the gross motor function measure, the pediatric functional independence measure for self-care, mobility, and cognition, the communication developmental checklist, and the functional assessment checklist for programming. Family-centered goal setting and caregiver measures include the COPM for family priorities, goal identification, and parental perceptions, the Family Empowerment Scale, the Modified Caregiver Strain Index, and the Caregiver-Child Interaction Measure. Once the family's priorities and goals are established along with the rehab specialist, an intervention plan is drawn up within the app for each child. Service delivery is performed by the community rehab workers visiting the child and family within their home to provide early intervention in all domains of development. CRWs use a coaching approach with the parents to develop the skills needed for everyday intervention. Consultative joint visits with rehab specialists, whether physio, OT, speech trainers, special educators, use a train-the-trainer approach to develop the skills needed for the CRWs to work with the families. Provision of assistive devices and products are also a priority to facilitate inclusion. Medical and surgical camps and consultation with medical specialists is also part of the program. Community-based awareness programs are the hallmark of the enabling inclusion model. 3 different types of program exist: community programs within villages, women program that are more like a healthy pregnancy, healthy baby type of program, and school awareness for school inclusion of students with disabilities. So these programs aim to disseminate knowledge and understanding of health and disability, to reduce stigma and attitudinal barriers towards people with disabilities in rural areas, and to promote an inclusive society and schooling system. The family-centered approach is highlighted by the focus on family empowerment and advocacy through family priorities and collaborative goal setting, caregiver capacity building using a coaching approach, early intervention parent support groups, group advocacy, the parent social media groups through WhatsApp for peer connection, and self-help groups for livelihood. Overall, till date, 70,000 children have been screened for developmental disabilities. More than 4,000 children and 9,000 caregivers have benefited from our services. And our studies have shown improved child development in various domains, caregiver empowerment and reduced caregiver strain, increased access to health services, and school enrollment for children with disabilities. We have more than 90,000 people who have participated in community awareness programs on the importance and availability of early intervention and child rehab services, on dispelling stigma associated with child disability, and on improving knowledge, attitude, and behaviors surrounding inclusion of people with disabilities. The innovative enabling inclusion model with its clinical digital app have been globally recognized and is now being used by 6 NGOs and in 4 states of India. It's being scaled up through various NGO and governmental partnerships. It's providing cost-effective, equitable, and sustainable home-based early intervention and rehab strategy for children and families in rural settings. So it has the potential to generate large-scale impact for development and social inclusion in low-resource settings. The Enabling Inclusion Model and app has received various awards for most inspiring digital innovation to the Zero Project Inclusive Education Award and was presented at the United Nations in Vienna. The World's Cerebral Palsy Day Award major award for medical therapeutics, and the MIT Solve for early childhood development. Microsoft Opportunities Award, and Asian Prégie Philanthropic Initiatives Award. So quite very exciting. So in closing, I wish to thank all of our funders, which have enabled us to develop the EI app, as well as our research partners and our software developers. And I'm sharing my contact information, and I welcome you to visit our website at Amar Seva Sangam, Enabling Inclusion, www.earlyintervention.amarseva.org. And a final thank you from the children at Amar Seva Sangam, Enabling Inclusion Program, and from me, Kadin Shela, for your attention, and Tashidele. Very nice being with you today.